The Twin Cities area is now part of an elite group in the field of hip replacement surgery. A significantly shorter recovery time and a less invasive procedure are some of the perks of the new SuperPATH hip replacement surgery.
Edward Moody joins us now. So SuperPATH, they really think that the doctors think you can have a much better, quicker recovery?
They do, and there are a few reasons for that. Now, of course, the results vary depending on the patient, but the one doctor in the metro who performs the surgery says patients are up and walking within a few hours of the surgery. Today, we met a woman who says she's living proof.
We could do something else if you want to.
Kay Schmidt has been in the daycare business for about 40 years. She's also an avid walker, but last January at a Super Bowl party, she says she almost lost both her passions.
I had to literally pull myself up the stairs by the railing.
As her condition worsened, doctors told Schmidt she needed hip replacement surgery.
My son said it was so hard seeing you grow old every day.
Fortunately for Schmidt, one of 7 doctors in the country that can perform the SuperPATH surgery works nearby at Park Nicollet Clinic in Burnsville.
So some people actually call it the ship-in-a-bottle technique.
Dr. Dean Olson says SuperPATH is different from traditional surgery because he actually builds the implant inside the body. The incision 2 to 3 inches versus the 8 to 10 inches in a traditional surgery like this one. The procedure also eliminates the need to tear things apart inside the leg.
There's no muscles or tendons cut. You never pop the hip out of the socket, so we never dislocate the hip.
And that, says Olson, is key. The lack of tearing and unnatural stretching allows most patients to be up and walking within 4 hours of surgery. Patients can typically walk unassisted in 3 to 4 weeks.
After 5 weeks, I walked 2 miles with my dog. Before my surgery, every step I took was painful.
Olson says unlike other forms of hip replacement surgery, SuperPATH is an option for pretty much any patient. Now, Kay Schmidt says the only problem she experiences currently is occasionally needing to switch weight off of her replacement hip while she sleeps. And Frank Amelia, I know that you all have some personal knowledge of hip replacement surgery yourself.
Yeah, I think that was my hip we saw.
Yeah, that was in fact your hip, yes.
One of the reasons I had the one I did is because I'm young and you can do a lot of impact on it. Can you still get back? Do they think that you can do that much, you know, regular basketball, hockey, that kind of thing on that hip?
They do, yeah. I spoke with the doctor about that, and that was one of the questions about who's eligible for this. Are there age, you know, limits and things like that? And he said, no, it really is. You have it, you back to normal 3 or 4 weeks, 5 maybe.
Walking after 4 hours.
Yeah, it really is. Yeah.
All right.
All right, thanks.
Thanks, Edward.